Namaskar, good evening, the viewers from India and as well as international viewers. Very happy to join you in this wonderful evening. At the outset, I should thank Santon for giving this wonderful opportunity, mainly because talking about eye care is so important. Eye is such a precious structure in the human body. Each and every layer in the eyes are so important for the wonderful sight. The precious gift what God has given us is one of the important organs in the human body. So we need to take care of it. How do we take care of it is the one which I would be talking in my presentation this evening. I'm so happy and protecting and taking care of eyesight. So eyesight, when I say eyesight, it I mean vision, I mean sight, I mean the joy of sight, the joy of vision. The precious gifts vision, what you, me, everyone enjoy. Let me go to this slide, go to the topic directly. As I was telling you, it's a very important sensory organ. Vision is a window to the world. With vision, we connect with others. With vision, we feel the happiness. And you should definitely know that 80% of our memories are determined by what we see. That's why eye is called the window. And this presentation is mainly brought to you on account of World Sight Day. Every year, the International Sight Day is celebrated during the first Thursday of every October. And on event of that Sight Day, this is because the whole world needs to understand there are people suffering visual impairments. This is statistics. What about the World Sight Day? As I was telling you, approximately 1.1 million of people are corneal blind in India. When I say cornea, I'm talking about one of the structures in the human eye, which I'll be telling in the further slides. Sight and vision, both are synonyms. Both, when you say sight, when you say vision, it all means that you're seeing. Sight is physical. It's a sensory experience in which light reflects off objects. The eyes then focus this light. And when I say vision, what I mean is how the mind perceives the images and interprets it. Sight allows a person to witness an event, but vision helps him understand the significance and draw the interpretations. And protecting your eyes and your sight is highly important, as I was saying before, that that you may avoid harm. Eye is such a complex structure. By seeing it outside, when you see a person's face, you see two beautiful eyes God created. And what you see, the black part and the white part externally, is just 15%. The remaining 85% is in the socket, in eyeball. It's a ball structure, it's in a socket. From front to back of the eyeball, the measurements of an eyeball is approximately about 23 to 25 millimeters, depending on different humans. From front to back, there are innumerable structures, as you see in this picture. This is a cross section, the cut section of the eye, from front, that is the black part of the eye, till the retina and the optic nerve behind. Every structure is so sensitive. Every structure is very important for a human to see and enjoy this wonderful world. Let us see what are the common eye problems. I don't want to go into the higher section of the problems. I'll talk about the minimal ones. Refractive error. When I say refractive error, it means that a person is not able to see properly, see the distance objects properly, and they are not able to uh, exactly identify, accurately see what others with a normal eye see. So this is simple. It can be corrected by spectacle or other latest technologies, which I would be talking. Refractive errors are myopia, hyperopia, and astigmatism. The other common problem is dry eye. In today's world, in today's digital world, without a computer, without a mobile, without any screen gadgets, life has become difficult. But at the same time, As an ophthalmologist, it is my responsibility and the duty to tell you that using screen gadgets is definitely essential, no doubt about it, but use them the right way, use them the perfect way so that you can take care of your wonderful eyes. There are other problems like allergic conjunctivitis. The allergy is one problem which is very common in India because of the pollution, because of certain other conditions. The human beings get allergy. The other common eye problems, let me try to differentiate the problems when a child gets it or when an adult gets it. In children, very common, as I was telling you before, is the refractive error. A child is not able to see a distance object properly. A child is not able to accurately perceive what is there in front of them. So that is refractive error. So it can be corrected with appropriate spectacles. We need to see the child early. If we miss seeing the child early, then you see the condition called amblyopia. Amblyopia is nothing but simple layman's term. You can call it as a lazy eye. Lazy eye is because the eye is not seeing. When you keep seeing things, the object what you see or the light enters into the eye, goes to the retina, from there to the optic nerve, and from the optic nerve through the optic nerve chiasma and the optic tract goes to the brain, and from the brain the signal comes back, and what you see, that's what is the wonderful physics, human physics happens inside. So amblyopia is lazy eye. When eyes don't see, there is a refractive power, the child is not being corrected with the spectacles, then unfortunately the child lands in lazy eye amblyopia. Next condition is strabismus, medically called, common layman's term is squint. When the eye is not straight, generally the eye is straight, when there is a deviation of the eyeball to one direction, there may be deviation of one eye, there may be deviation of both eyes. It depends upon what kind of squint the child has. So squinting has to be corrected at very early age, very important. It can be medically corrected with spectacles. There are certain conditions, and there are certain conditions when you need to go and do an early surgery to the child to prevent that wonderful vision. So the other condition is ptosis. When I say ptosis, it means drooping of eye. I'll come back to that. And I was talking about the children. Now let us talk about the geriatric group, the older people. Older people have multiple eye conditions like presbyopia. Presbyopia, I would say, not exactly old, the middle-aged, where the people touch their 40s, early 40s, are not able to read a reading material, or not able to view the mobile properly. Whatever they see looks very hazy, and the letters are not very clear. That is presbyopia, otherwise a near vision problem which can be simply corrected with spectacles. Next is cataract, glaucoma, age related macular degeneration, and another important cause is diabetic retinopathy. We will be discussing one by one. Hope it really is interesting to you. It really is informative to you. Let's go to the refractive error. When I say myopia, it is otherwise common name is nearsightedness. When I say nearsightedness, what I mean is a person is able to see near objects clearly, and they are not able to see distance object. That they have a good nearsightedness, they do not have a far sight. That is myopia. Myopia can be simply corrected in younger individuals with spectacles. The other options available in today's world are contact lenses, and the best treatment when the person crosses 18 years would be giving them the spectacle freedom, giving them the contact lens freedom, by doing a LASIK laser, which is called as a refractive surgery. Very simple. Whatever the power they have, doing a very simple surgery on the ocular surface, exactly on the cornea. And that's a very simple procedure which takes only 3 to 5 minutes each eye. And then the patient is able to see very clearly. And they can get rid of those glasses which they've been wearing since their childhood. They can get rid of the contact lenses. Sometimes contact lenses are very difficult using them. By not using contact lenses properly, The patients may land in severe infections of the eye, lose the eyesight. So the advantages are doing a LASIK surgery to them and give them the best vision. And next is hyperopia, otherwise called as hypermetropia, which is farsightedness. The patient is able to see far objects very clearly, and they have difficulty in viewing the near objects. When I say near objects, it's not only the reading material. An object which is just a meter or 2 meter away is also uh, difficult for them. In hyperopia, what happens exactly is the eyeball, which I was talking about in the beginning, which is around 23 to 25 millimeters according to the individuals, the eyeball is small. In myopia, whereas in myopia, the eyeball is slightly larger. When I say larger, it's just I talk in micromillimeters or just a millimeter. Even a millimeter change would make a difference of minus 3 diopters of power. So hyperopia once again can be corrected with spectacles, can be corrected with contact lenses. We can correct it with LASIK laser also, depending on the condition, how the patient has presented with us. I was talking about lazy eye earlier. Lazy eye is nothing but the common layman's term for amblyopia. Amblyopia because the child is not able to see, because the child did not wear glasses, because the eye was squinting. In this picture, if you see clearly, the right eye of the child is seeing straight. The left eye is deviated towards the nose. It can be deviated inside, which is called as esotropia medically. When it is deviated outside, it is called as exotropia. Outer deviation, inner deviation. All this can be corrected. There is wrong myth in certain olden days when people used to say, leave the child with squint, leave the child with strabismus. That's a sign of good luck. I'm sorry to say I don't have any right to talk about good luck in a child or not a good luck in a child. But my point to be very clear is kindly do the correction to the child, a spectacle correction. Treat the amblyopia with occlusion. You can see a picture in the this side of the screen where the eyes which is seeing normally is left open. The eyes which are dull are left open, and eyes which are seeing better are closed. What are we doing by doing this is stimulating the eye to see. So when the better eye is closed, the non-better eye tries to see, tries to visualize, and even the squint becomes straight by visualizing, so that you can correct amblyopia and you can correct the lazy eye surgery also. Next, refractive error is an astigmatism. Astigmatism, like hyperopia, myopia, is also a refractive error, but it is more of in the cornea, the shape of the cornea. There are multiple layers in the cornea, but the ocular surface, the corneal shape differs. The corneal curvature differs, causing this astigmatism, and we need to correct it with spectacles by giving them the cylindrical glasses. If you have seen your glass prescription, if you're a glassware, there's a component called spherical, there is a component called cylinder, there is a component called axis. That cylindrical power is what is corrected for astigmatism. You can correct astigmatism with contact lenses, and of course, astigmatism can be corrected with this wonderful LASIK laser also. I was talking about the squint when I was talking about lazy eye. Squint, once again, strabismus is an important thing. As I was telling you, it's a deviation. The deviation may be because of the muscle dysfunction. The eyeball is holded with 6 muscles, and the muscles move upward, downward, right, left, in all different gazes, directions. So when there is muscle imbalance, when there is muscle impairment, when there is muscle dysfunction, this eyeball doesn't move to the real direction it wants to. So squint is such an important thing in a child which needs to be corrected. Correction is very essential. I'm stressing on this point. Leaving the child without doing a surgery leaves the child being blind, leave the child with visual impairment. When I was talking earlier, I was talking about ptosis. Ptosis is nothing but drooping of eye. If you see the picture, the right eye is completely open, but the left eye, the upper lid is drooped down, is stooping down. So this is once again, uh, this condition usually doesn't become better on its own over time. Children may need treatment such as surgery in order for vision to develop properly, particularly in children. Elder people, okay, you correct it for cosmetic reasons, but for a child, you need to correct it because, as I was telling you earlier, to prevent a condition called amblyopia. And it's better if you see a child at any age in this condition, kindly refer to an ophthalmologist at the earliest. Next comes the cornea. Cornea is nothing but the black part of the eye, the central beautiful structure uh, accompanying the white structure in the sides. This cornea is surprisingly is a very thin tissue, very thin tissue, and its thickness is roughly about half a millimeter, 545 micron thickness. So this thinner structure already has 5 layers in it, and every layer is in the micro level. And this is something like a watch glass. Through a watch glass, if you see a watch, you see the time inside. It's a transparent structure. Though the cornea in the eye is a black, called as a black part of the eye, that black is nothing but is a reflection of the iris muscle structure which is behind. For people in India, it's more brownish iris. So you see it, you see the cornea as darker color or black. In a Western population, you can see grayish eyes and bluish eyes because the iris is lesser colored. The pigments in the iris are very less. So cornea develops ulcer, which is very important because we need to prevent the corneal blindness. Corneal blindness is something like a disaster. We need to prevent it. So, an ulcer is nothing but an infection in the eye. The infection may be due to multiple reasons. Maybe bacterial infections, maybe a viral infection, fungal infection, which is very common in the rural populations because the length and breadth of our wonderful India, from Kashmir to Kanyakumari or Mumbai to Bengal, Kolkata, this side, we are full of rural agriculture, farmer, such land is what India is. So these are the places where farming and agriculture is very important as a breadwinner for them. So during farming, there may be something which agriculture, something falling in the eye, which causes a fungal infection, which is very important to be treated at the earliest. If not, it might cause blindness. It might cause an opacity on the cornea. The transparency is lost, making it opaque, and the vision is lost. You can correct corneal ulcers with appropriately with early treatment, early medications, and you can definitely treat it. But in case left at a longer period, the cornea becomes totally infected. If it becomes opaque, then you need to do a surgery. A surgery is nothing but an corneal transplant surgery. Corneal transplant is nothing but you get cornea from eye donations, which I will be talking in my further slides too. From eye donation, you get the cornea. Those cornea are grafted into such eyes and try to give them the best vision possible. So, better prevention. Prevent any problem, not only in the eye, from head to toe, any disease, any problems. Try to prevent it primarily rather than suffering a secondary problem in that particular organ. Conjunctivitis is otherwise called as a red eye or a pink eye. The medical name is conjunctivitis, very common in southern population in India. Now it is across the country because earlier, in very earlier days in 1970s, it started in the old Madras constituency where it used to be called as a Madras eye, otherwise called as a red eye, otherwise called as a conjunctivitis. It may be a bacterial conjunctivitis, but what now very common is an viral conjunctivitis. Viral conjunctivitis, once again, is very important, which is an inflammation in the eye with a secondary infection. But once again, treated early can prevent unnecessary problems. It is in today's time, it is definitely difficult to treat it because the virus tends to give new avatars. So sometimes it's difficult for the ophthalmologist to identify and treat. but at earlier stages, we can prevent a major problem because of conjunctivitis. Next, coming into the major issue in the eye, which is in the geriatric population, which is in the senile group of patients, nothing but cataracts. What is a cataract? Okay, people talk about cataracts right, left, and center. A cataract is a clouding of normally clear lens. We have a lens where eyeball, you see the cornea in front. I said the iris is behind it, and behind the iris, you see the lens, the normal crystalline, clear, transparent lens. This lenses become opaque. The opaqueness become maybe due to age. Age is one factor, senile geriatric problem. The other, if there is an injury, a trauma in the eye, can cause the lens to become cataractous. Due to other causes like diabetes, diabetes can cause people to get cataract early. Anemia can cause problems in the eye, likewise called cataracts. Dehydration in the body due to various problems can cause, and chemical injury or a phototoxic injury can cause cataract. And it is very important to identify cataract and treat it. Unfortunately, in India, people or the patients come at a later stage when the cataract matures and becomes a whitish cataract, or rather a milky cataract. So cataracts in today's world can be easily treated with very good surgeries. We have the micro incision surgeries available today, and it's become a walk-in, walk-out surgery. Not like olden days when you need to admit the patient for a couple of days. You need to make a big opening in the border of the cornea, and then remove the cataract, then place the lens, then put around 10 to 12 stitches, sutures. The days are gone. Today we have the micro incision. You don't need to open a 10 to 12 millimeters in the cornea. You can do a sub 2 millimeter, 1.8 millimeter. It's become so, the incision is so small, just enter the eye in a micro level. You have this wonderful phacoemulsification technology by which the cataract can be emulsified with ultrasonic waves, brought out into bits and pieces, sucked out, and you have wonderful intraocular lenses. Olden days, they never used to fix intraocular lenses because they weren't available. But now there is availability of wonderful intraocular lenses which can correct even distance and near. They are called as multifocal lenses. It can correct distance vision, it can correct near vision. You can be spectacle free even after you develop a cataract in your late 50s, 60s, 70s, and 80s. You can be totally spectacle free. You will have a wonderful vision which you had in your younger ages. That's what is an advantage of today's micro incision cataract surgery. As I was talking, cataract is a clouding of the vision. It fades colors. You will not be able to appreciate things. If you see the picture over there in the corner of the screen, you are seeing that there are human beings standing. It's a ghost image. You cannot identify the exact face who's there. That's how cataract makes a patient temporarily blind, because these are all curable blindness. We can cure it with wonderful surgeries. As I was telling you, a simple surgery, micro incision surgery, open up, go inside, take away the cataract very simply in micro levels, and place a beautiful intraocular lens inside, and make the patient see wonderfully. From cataract, I go into one more condition as glaucoma. See, glaucoma is one condition where I always stress in every meeting. The reason is cataract, okay, age related, it has come, it is gone. Glaucoma is a silent thief. We do not know who's going to get glaucoma. Anybody who's more above the age of 50, above the age of 60 can develop glaucoma. People who are young, if their parents, if their grandparents have suffered from glaucoma, can get glaucoma at an even teen ages. Glaucoma is nothing but a condition where the optic nerve inside gets damaged. When I say damage, it is an irreversible damage. That's what is very important. You cannot reverse it. Optic nerve, any nerve in the body, if it degenerates, it's tough to get it back. Making it regenerating is a tough job. So the optic nerve gets damaged because there is maybe due to an injury, maybe due to other structures, but primarily there is something called as an intraocular pressure, like the blood pressure what we have, like the intracranial pressure. There's a pressure called intraocular pressure, which is nothing but an eye pressure. The eye pressure for any normal individual is around 10 to 20 millimeters of mercury. That's normal. There are people who do not know they have intraocular pressure and come to a stage when the pressures are 30s and 40 millimeter of mercury, where there is almost 50 to 70% of damage of optic nerve inside. That's why, as ophthalmologists, we always stress you need to definitely uh, go and meet an ophthalmologist after 35 years of age. Earlier ages, we are wearing spectacles. Definitely, early treatment, early ophthalmologist visit is important. Treatment is important. When you're above 35, even if you don't have a spectacle problem, even you don't feel that your eyes are normal, please visit an ophthalmologist. Like if you generally the entire medical check today, doing an ECG, checking your blood pressure, checking your blood sugar levels, have become a normal phenomenon because you can prevent the problem, detect it early. Likewise, glaucoma, an yearly ophthalmologist visit will definitely try to help you to detect the intraocular pressure rise and try to treat it. Very high intraocular pressure can be identified by a simple technique called tonometry, which is nothing but measuring the intraocular pressure, which you see the picture over there. There are different kinds of glaucoma. There is condition called open angle glaucoma. There is condition called open angle, closed angle glaucoma. Let us not go deep into it. Glaucoma is a condition which is a blinding disorder which needs to be corrected, medically corrected, with wonderful eye drops available today. You can treat it with eye drops. In some conditions, you may require a laser surgery, which is called as a laser iridotomy, which is simple. When their angles are blocked, you create an artificial opening to allow the fluid to come outside. As simple. When the fluid is not gets blocked, does not come outside from the inner eye to the outer eye, then the intraocular pressure develops inside. The more the pressure, the more the damage to the optic nerve. So you can correct it with a laser iridotomy therapy. The other, when you have gone to a stage when the intraocular pressure is not reducing, in spite of doing a laser therapy, in spite of applying medications regularly, you have the surgical options available. There are multiple surgeries today. Like I was telling, in cataract, when there are minimally invasive, the micro incision surgeries. Likewise, in glaucoma, we have very minimal invasive glaucoma surgeries, and by doing a surgery, we make an artificial drainage to the fluid, which is called as aqueous humor, to flow out and prevent or keeps the intraocular pressure under control and does not allow the further damage which is happening to the optic nerve. From glaucoma, I take you on to age related macular degeneration. As the name itself says, it is age related. This condition generally comes, people are in an elderly group, where there is a condition, there is an condition called macular degeneration, which is a geriatric problem. There are multiple other causes, like very high myopia can also cause an degeneration. This is age related. So this age related, otherwise simply called as an ARMD. There are two conditions. There is something called as a dry AMD. There is something called as a wet AMD. This also has to be identified early and try to be treated. Once again, it is age related. It is progressive, but for most of the time, it is slowly progressive. So it can be identified early. We can treat it with antioxidant tablets. We can Ask the patients to have a very good, healthy vitamin A diet, wonderful green leafy vegetables. Also, avoid ultraviolet rays, also avoid sunlight. They need to be very protective. So, this age related macular degeneration does not progress. This condition also you can see in people who are smokers. Uh, Particularly in smokers, this condition occurs much earlier than it has to occur in that particular age. So there are conditions where you can identify what happens inside by doing a couple of diagnostic tests like optical coherence tomography, which is an wonderful tool, which is an very good tool aided to the ophthalmologist. Though we clinically see the eye, see the retina inside, see the macular structure inside, this machine is a non-invasive procedure, detects and tells us exactly what is happening there. The other is called as a fundus fluorescein angiography, where you inject and dye inside the blood vessel and probably take serial pictures and then find out at what stage is it. Earlier stages you can definitely treat with antioxidants, but at a later stage I would suggest the patients to have a regular follow-up to their particular ophthalmologist, and we have this anti-VEGF injections today available. There are multiple steroid injections available today, which we can inject inside the eye, intravitreal injections, and try to treat and preserve the eyesight of the patient and prevent further damage which is going to happen. Diabetic retinopathy. The name itself tells you this condition occurs due to diabetes. Diabetes is one condition which is a very alarming condition. Dear friends, people who are diabetic, kindly understand that your blood sugars needs to be under perfect control. You cannot allow your diabetic glycemic levels to shoot up. There are patients who come and say that they have, when we ask what are the blood sugars, they say, we have seen last month it is normal. It can, it's, if it is normal, well and good. It cannot be normal most of the time. So please kindly follow up a very good diet. Diet control is very important. Associated factors like BP, hypertension, associated factors like kidney problems, associated factors like anemia, all can progress this condition called as diabetic retinopathy. So, a retina, which is a structure, which is a film in the background of the eye, gets a disease. Retinopathy is nothing but, pati is a Greek word which is called as a disease. So, retinopathy is a disease to the retina which is caused due to diabetes. That's what the name implies. Very simple. Patients see something like spots, dark strings floating in front of your vision. They are called as floaters. When I say floaters, it can be due to your vitreous gel also, but generally people having diabetic retinopathy will complain of dark spots in front of the eyes, vision reduced, and floaters. The vision is blurred. Vision fluctuates. When the diabetic status fluctuates, the vision also fluctuates. They cannot appreciate the color properly, and it's very difficult for them to be in dark areas. And as I was telling you, control is the main treatment for it. So when I say diabetic retinopathy, as I was talking about the risk factors, I would like to talk to you about how to treat it. As I was telling, all the preventive measures, once you are identified as a diabetic retinopathy patient, regular follow up to the ophthalmologist is very important. And we have lasers. The technology has grown beyond expectation today. We have lasers, green laser, we have the yellow lasers to treat the bleeding spots on the retina, that is called as photocoagulation. By doing it, we prevent further damage to the retina. In advanced diabetic retinopathy, unfortunately, the patient loses the vision, and we need to go inside and do a major surgery called as an vitrectomy surgery, and try to remove the bleed inside, and after removing the bleed, give lasers in the retina and try to preserve at least some vision for that patient. As I was telling you, vision, sight, everything is very important for life. You cannot be without vision, you cannot be without sight. So it is important for us to, as ophthalmologists, for us to do the best to the patients and try to give them the best available possible treatment and preserve their vision and make them at least enjoy that extra time in that life. So from diabetes, I move on to eye strain. Eye strain is one condition which is gaining a lot of importance in today's world. You yourself know why. Because you are seeing my presentation now in front of a screen gadget. Okay, this is a presentation which is of medical importance, but the screen gadgets are used unnecessarily for multiple other reasons. You all know that. We all know that. We all do the same mistakes. As an ophthalmologist, it is my duty and responsibility to tell you, try to use the screen gadgets as less time as possible. You need to use it for your work. That's your profession. Nobody can stop it. In today's scenario, in this turbid COVID times, the students, the children are unfortunately sitting in computers for hours together because they need to have their online education happen. I'm not blaming the online education. It needs to happen. The child needs to develop, the child needs to study. But that excess time spent on it due to profession, due to education, is advisable and acceptable. But using screen gadgets for your browsing, your other reasons, your social media entertainments and other thing, I'm not telling stop it. Try to limit it as much as possible so that you can prevent a condition called computer vision syndrome. Eye strain is one condition which gives you a lot of headache at the end of the day. The eyes burn, burning of eyes, irritation in the eyes, intense headache. The eye becomes too watery at the end of the day. The vision sometimes is so blurred, and you will not be able to focus the structures properly, which you need to do. So it's very important. Overexposure can definitely harm eyes, as I told you. So try to use your computers as less time as possible. And once your eyes are tired in certain conditions, when you've worked more, you need to use the lubricant, the artificial tear drops, so that it keeps your eyes wet, moist, and comfortable. And as I was telling you, using it for longer duration definitely causes this problem. Try to use it as less time as possible, and make use of the wonderful, intelligent computer the right way. So, as I was talking to you about the digital devices usage during the turbid conditions, you see the percentage over there on your screens. Because of the COVID time, people in the lockdown were staying inside. The amount of percentage of time spent daily news, which was very important during the early days, even every time news is important, 57 percentage. And smartphone use, chatting, social media, video on demand, luckily 3%. So the usage was more. So the more the use, the more the problems which occurs to the eye. The impact of the daily eyes, which I was talking about, happens very regularly. I would like to tell you some healthy tips. Try to sit as far as possible from the monitor. The best would be a laptop or even or a computer rather than your iPads and your mobile, which are much smaller. You keep it much closer to your face, closer to your eyes. So try to keep it at a distance. Lower the brightness intensity in any screen, which is very important. Don't have a bright screen. Keep your eyes moist so that keep it not exactly washing, You can take a clean handkerchief, wet it in normal water, and keep it over your eyes. Keep it to keep it moist. And there is a 20-20-20 thing. Now the IPL 2020 is going on. This is not that 2020. This is 2020 and 20. 20 minutes, look at a 20 feet away for 20 seconds. Very simple. 20 minutes, every 20 minutes gap, look at an object which is 20 feet away for 20 seconds. By doing this, what do you achieve is the dryness is reduced. And I would also ask you to do blink your eyes as much as possible. There are studies which have shown that when people who are hooked on to the screen gadgets do not blink their eyes because they are constantly watching, they don't blink. Blinking is important, but this wonderful physiology which happens over there, this mechanism is every time you blink, the natural tears over there from the lacrimal glands in the corner of the eyes, every blink, it makes the tears come out, flow on the ocular surface, flow on the cornea, makes it wet. So blinking is very, very important. As I was telling you, studies have showed that a patient does not even blink 2 to 3 times or maximum 5 times only in a minute, when a patient needs to blink in front of screen gadgets at least 30 times. That's what it is. The more you blink, the more tears on the cornea, the more wet and moist is your eyes. There are a few more slides, and this slide is once again, which is very important, as I was talking to you in the earlier slides also, need for regular eye checkups. If you have a problem, it may be a simple spectacle problem, yearly visit to an ophthalmologist is very important. Otherwise, if you have diagnosed with glaucoma, if you have diagnosed with diabetic retinopathy, if you are diagnosed with age-related macular degeneration, or if your ophthalmologist has told you you have some other problem in the eye, a regular follow-up, it may be 3 months, it may be 6 months. A regular follow-up, which is very, very important. A complete eye examination is important. You can't just go correct your spectacles at an optical shop. You need to meet an ophthalmologist and get your eye checked thoroughly. Your power, which is checked by a visual acuity, your refraction assessment by giving your spectacles, your visual field test. Your glaucoma, as I was talking about, reduces your field of vision. So your field test, a normal biomicroscopic slit lamp examination, your background of the eye examination, the retinal examination, all this is very, very important. As I was telling earlier, even though you don't have any eye problems, you've crossed your 35s and 40s age, definitely meet your ophthalmologist annually. Annually have your complete medical check. There is nothing wrong. You can detect a problem, you can identify it and treat it accordingly and appropriately, and prevent a big disaster which is going to happen to your human body or human organ structures. So now I pledge. What do I pledge? Donate. These are wonderful pair of eyes God has given us. This wonderful pair of eyes should not go wasted, should not be burnt, should not be buried. There's no emotions over here. You are giving somebody in somewhere, in some other city, some other world, a sight which they do not enjoy. When we enjoy, after the demise, after the death of a person, your eyes can be donated. You can make two people who are not known to you see this wonderful nature, see the beautiful colors in front of them. They've probably not enjoyed it properly. They would have enjoyed it at the early age, but when they're in their teens, when they're in the middle age, they would have not enjoyed the wonderful God's gift. So, ice donation is very, very important. Take a pledge today, dear friends, ladies, gentlemen, everyone who's watching, everyone who are going to watch future. Please take a pledge today that you will be donating your eyes after your demise. It's very important. And by taking a pledge today, you're not going to donate it today. You're taking a pledge. So someday, sometime, you will still see this world even when you're not here. That's very important. So I would give you some tips before I close the session. Uh, Regular wearing of spectacles, if you have been advised, please wear your spectacles regularly. A constant use has been advised, yes, constant use. If you've been told to wear it for reading alone, well and good. If you've been told to wear it while on computers, while on screen gadgets, please do it. Otherwise, good sleep is very, very essential for your eyes, for your brain, for your heart, for your entire system. So, good sleep is very important. At least around 7 to 8 hours of sleep every day. The third point I would stress is give maximum rest to the eyes. Using screen gadgets is essential, but use it the right way. Give maximum rest to the eyes. Drink sufficient amount of water. Water consumption is important. Have good vitamin A rich diet. A patient asked me, Doctor, what are the vitamin rich A diet? Yes, I'm happy to say. All green leafy vegetables, the spinach, the greens, papaya, broccoli, all these have very high, rich vitamin A content in it. It has other vitamins, other minerals, other antioxidants, but it has vitamin A, which is very essential to the eyes. Almonds are supposed to be very good for the eyes. Egg, once again, high content of vitamin A, which is very good for essential strength and vision sight of good eyes. Milk, very important. And if you are a mixed diet, if you don't mind eating a non vegetarian source of food, then of course fish has rich content of vitamin A. All these natural resources are there. So please eat them appropriately, correctly for your good health. Avoid sunlight. Sunlight is very important. It has vitamin D, it has everything for your body, bones, skin, everything. Avoid direct exposure to the sunlight. That's what I mean. Have wear darker glasses when you're in sunlight, and you try to wear a hat or a cap so that light rays do not enter directly into your eyes. See, these are all very good tips to have your healthy eyes. And there are few symptoms and signs you would come across in your life. In those times, they are all ophthalmological medical emergencies when you need to meet an ophthalmologist immediately. We, as ophthalmologists, are there to treat you, we are there to take care of you. So many symptoms like floaters in front of you. You see black particles floating in front of you. That is an emergency sign. The eyes become very red, pink eyes. Those are important sign. It cannot be a simple allergy or a conjunctivitis. It can be an glaucoma, which can be an advanced glaucoma, which increased pressure, which is causing red eye. It can be some other blood obstructive conditions in and around the eye, which can cause redness in the eye. Acute pain, severe pain in the eye is an emergency sign. When you're not able to see, which you are seeing regularly, a sudden loss of vision, suddenly losing vision or sight is important. These are all emergencies. In these times, don't wait for it to correct it by itself. You need to meet an ophthalmologist very, very early. So, dear friends, ladies, gentlemen, I really believe that this presentation would definitely would have given you the information what you really required, and I think I would have given you the I would have given you the best message which I need to give you, and at the same time I would have done the justice to this presentation. So thank you so much for patiently listening to the presentation, and live happily, see happily, enjoy this world. May God bless you all. Thank you.
Thank you so much, sir.
Okay, fine.
Thank you
Thank
so
you.
much,
Thank
sir.
you, Shiv Kumar. Thank you, Shiv Kumar.
Sir,